Hi, my name is Crystal and I'm one of the veterinary technologists here at the Martensville Veterinary Hospital. Today I'd like to talk to you a bit about the importance of dental health care. Afterwards, I'd like to take you on a step-by-step walkthrough of what happens when you bring your pet into our clinic for a dental prophy or cleaning. At the Martensville Veterinary Hospital, we believe in preventative care, which is why we recommend brushing your pet's teeth on a daily basis. This helps to remove any plaque that is formed on the teeth, preventing it from hardening into calculus, which is also known as tartar. We also recommend yearly dental cleanings to remove any calculus that may have developed. Without regular dental care, your pet can begin to have bad breath, which is also known as halitosis. This is often the first recognizable sign of dental disease. If left long enough, the bacteria in the mouth could enter the bloodstream and cause serious problems throughout your pet's body. So what exactly happens behind the scenes once your furry family member has entered into our care? Well, let's start from the beginning. Before we admit your cat or dog into our hospital for a dental cleaning, one of our veterinarians will first perform a pre-anesthetic examination of your pet to ensure that they are healthy enough to go under general anesthesia. We will first give an intramuscular injection of a sedative that will help your pet to be anesthetized easier and in a safer way, in that we can use less anesthetic medications. The next step is induction. First, we will place an intravenous catheter. We prepare the site, insert the intravenous catheter, and then securely tape it in. One of the benefits of having an intravenous catheter in place is that we can administer fluids throughout your cat or dog's entire dental surgery. This helps to maintain an adequate blood pressure. The second advantage is that we can administer medications intravenously, which acts much faster in cases of an emergency. We are now administering an induction medication that helps us to intubate your pet. Here we are placing an endotracheal tube, which is also known as intubation. This allows us to administer oxygen as well as a gas anesthetic through their trachea and into their lungs, which keeps your pet under what we call general anesthesia. This is also another method of administering emergency medications. Here we are inflating the cuff to ensure that the endotracheal tube is appropriately placed. Next, we lubricate your pet's eyes as they are unable to blink at this point, and we must keep the eyes moist. Now we are hooking up the monitoring equipment. As you'll be able to see here, we can measure your pet's heart rate, respiratory rate, blood pressure, and temperature, as well as carbon dioxide and oxygen levels. Now that your cat or dog is entirely hooked up to our monitoring equipment and is steady under general anesthesia, we will begin to take full mouth radiographs. Radiographs help us to visualize not only what lies above the gum line, but the tooth roots below it as well. We wear a full lead apron and thyroid collar to help protect ourselves from excess radiation. We also have a dosimeter placed underneath our lead apron to measure the amount of radiation that we are exposed to. We also wear a surgical cap, mask, smock, and gloves to ensure that we do not give any extra bacteria to your pet or contract any to ourselves. To ensure that your pet stays adequately warm throughout this procedure, we place a heated water mat underneath them and often place a warm blanket on top of them with a heated beanbag if necessary. As you can see in this radiograph, Mace actually has an extra tooth. The next step of our dental assessment is to probe and chart the teeth. We evaluate each tooth on its degree of plaque and calculus, note any chips, fractures, enamel wear or furcations, and measure for periodontal pockets on 6 aspects of each tooth. Next, the veterinarian will step in and evaluate the radiographs and your pet's mouth by comparing what they see to what our charting states. Here you can see us placing a dental block as Mace needs to have a tooth extracted today. This ensures that her nerves are blocked or frozen around the tooth in question so that she does not feel the extraction. We will now begin to clean your cat or dog's teeth by using an ultrasonic scaler to rid her mouth of any plaque or calculus that has formed. Lastly, we will polish their teeth to be sure that there aren't any microscopic indentations that were caused by chewing or by our scaling. These tiny indentations create an ideal harbor place for bacteria if left and not polished away. This would cause faster buildup of plaque and calculus in the future. Our very last step is recovery. One of the indications that we use in dogs to determine if we can extubate or remove the endotracheal tube is the dog regaining their ability to swallow. In cats, it is the regaining of their ear twitch reflex when we softly blow on their pinna. Sometimes we may use gentle stimulation to help wake your pet. Recovery often requires time and patience and always requires direct supervision to ensure that there are no complications upon your pet's recovery. And there you have it, a complete walkthrough of your pet's comprehensive oral health assessment and treatment.